Hello, and thank you for joining us on our journey as we learn about schizophrenia. This presentation is brought to you by Terry Alden, Elizabeth Casanari, and Shanna Howe, in fulfillment of the requirements of Special Education Course 8008, Working with Children with Emotional and Behavioral Disorders and Autism Spectrum Disorder at Fitchburg State University. We will discuss what schizophrenia is, then we will review the symptoms and phases that comprise schizophrenia. Following this, you will participate in a brief activity. From there, we will share the diagnostic criteria required for diagnosis. Additional discussion will include the origins and risk factors of schizophrenia. We will then move on to the impact of schizophrenia, and we will conclude with treatment options and resources available for those impacted by schizophrenia.
The content in this presentation is for informational and educational purposes only and does not substitute professional medical advice or consultations with healthcare professionals.
According to the American Psychological Association, schizophrenia is a serious mental health illness and brain disease that involves a psychotic episode. Schizophrenia usually presents in early adulthood. It interferes with a person's ability to think clearly, manage their emotions, make decisions, and relate to others. The onset of schizophrenia can have profound and lasting effects.
The symptoms of schizophrenia vary from person to person, both in presentation and in intensity. A spectrum. Symptoms, however, tend to fall into three main categories. Psychotic symptoms, also called positive symptoms, the first category, and the symptoms that most people associate with schizophrenia. According to the National Institute of Mental Health, or NIH, psychotic symptoms include hallucinations, where a person's sensory input provides them with inaccurate information, meaning seeing, hearing, smelling, tasting, things that are not actually there. Delusions, when a person has beliefs that are not true and appear irrational to others, such as irrational belief that people are trying to hurt them. Thought disorder, when a person has ways of thinking that are unusual or illogical, such as disorganized thoughts or speech. Movement disorder, when a person exhibits abnormal body movements, often repeating movements over and over. The second category, and less well-known category, is negative symptoms. NIH lists negative symptoms as having trouble planning and sticking with activities such as grocery shopping, having trouble anticipating feeling pleasure in everyday life, talking in a dull voice and showing limited facial expressions, having very low energy and spending a lot of time in passive activities. In extreme cases, a person may stop moving or talking for a while, which is a rare condition called catatonia. Negative symptoms are often mistaken for symptoms of depression and other mental illness. The third and final category of symptoms in schizophrenia is cognitive symptoms. NIH states that cognitive symptoms include problems with attention, concentration, and memory. These symptoms can make it hard to follow conversation, learn new things, or remember appointments. Moreover, NIH states a person's level of cognitive functioning is one of the best predictors of their day-to-day functioning.
Like the symptoms of schizophrenia, the phases vary from person to person both in intensity and duration. Phases fall into three main categories. The prodromal phase is the first phase in schizophrenia, and according to the APA, the prodromal phase may build slowly or over a period of years. This is when symptoms first start. Lauren from Living Well with Schizophrenia provides an outline of what to expect in the prodromal phase.
Issues with your memory. You have changes in your mood, whether it's more depressed, more elevated. You have a general loss of energy. You have sleep disturbances, whether that's getting too much sleep or too little sleep. Changes in weight, so you could be gaining weight or losing weight. Loss of pleasure, so not really being able to enjoy the things you once were able to. Decreased performance, so this might show up in the way of decreased performance in school or work or something like that. Changes in appearance, so this often takes the form of not really being able to keep up with hygiene, but it could look differently too. Changes in perception, so what I noticed for myself is I started to see the world a little bit differently and how I perceived things was shifting. And lastly, religious obsessions. So these are some of the most common early warning signs of schizophrenia during the prodromal phase. It may look differently for every person, and it doesn't necessarily mean that you're going to develop schizophrenia if you're experiencing these things, but these are some common things to look out for.
In addition to these symptoms, the APA notes that some people may experience behavioral symptoms such as social withdrawal and isolation, and a disconnect from emotions, as well as additional sensory symptoms, such as odd or unusual sensory experiences that can include audio and visual hallucinations. The second phase in schizophrenia is the acute phase, and the APA states that the acute phase must be at least 1 month long. The Center for Healthcare Services explains the acute symptoms of schizophrenic psychosis.
It describes what happens when people are experiencing and perceiving the world around them differently than others. These differences can include seeing things that are not there, such as people, animals, colors, or shapes, even shadows, hearing voices or sounds that other people do not hear, disorganized thinking that can make it difficult for other people to understand what they're trying to say, sharing thoughts or beliefs that others who are close to them might find strange or unusual, such as believing that they have special powers, or that they're being watched, followed, or spied on, or that they are receiving messages through the television or internet that they feel are meant just for them. People who hear and see things that others do not may appear to be distracted or take a few moments to respond when asked a question. Sometimes, people experiencing psychosis may have a hard time concentrating, or their thoughts can get mixed up. Every person's experience with psychosis is unique.
The APA additionally lists grossly disorganized behavior, along with disorganized thought and speech within the acute phase. The third and final phase in schizophrenia is the residual phase. This phase is described briefly by Kristen Stone of the Schizophrenia Spectrum Project.
What is the residual phase of schizophrenia, where it's the phase of schizophrenia where symptoms may decrease significantly or fall away completely? Ugh, this is such a boring phase. Yeah, I hear you.
According to APA 2020, the residual phase can last for years. Moreover, these symptoms are less severe than the acute phase. The symptoms which are similar to the prodromal phase are often the most debilitating.
Look out! This is pointless. Even that kid knows you're stupid. Everyone knows you're stupid.
Don't go in there. Don't go in there.
Nobody cares about you. Why do you even try? Why do you even bother?
What are you looking for?
Everything's listening to you.
You don't deserve
The
this.
wine bottles.
See, they're laughing.
She's looking at you. They're looking at you.
Everybody laughs at you.
Everybody's talking about you.
Go ahead,
make you fat.
get some ice cream.
You don't want that.
Worthless.
It'll make you fatter than you already
Never
are.
been born.
Worthless.
Look
Pointless.
out.
The alcohol.
Trash.
Take it all. No, don't take that much. No, go over to the other one. Grab a wine bottle.
Go ahead.
A couple bottles of booze. Just
Drink it.
Drink
Eat
it
it.
until you're
Look out.
passed out. Nobody cares.
Pointless.
Where do they
Nobody
go?
loves you. No one could.
Some junk food.
They don't care.
The
she's
people. They're talking about you.
Even he
Because
can't
you're such a
even
loser. Oh, he's walking away because you stink. You smell.
Why do you bother?
You're stupid.
They're fake
He turns back
smiles.
to you because he doesn't like you.
Get you.
Oh. And she's leaving because you're worthless.
You should have never
Oh,
been
yeah,
born.
go ahead. Grab it all. Eat all the food.
Don't touch that.
Eat it all.
Don't touch
Why
that.
bother getting out of bed?
Doesn't matter. Doesn't matter how fat you get.
What are you thinking?
Go ahead. Don't eat
You
that
don't
one.
want that.
Don't drink that one. Go get some
You're
alcohol.
going to die.
Go get the ice cream. Oh, you
Give up.
Oh, the lights.
There.
Lights.
Where'd they go?
The lights
Where are they?
whispering. They're whispering to you. They're calling your
I'll
name.
after you. Look out. She knows. She knows.
Drink me.
Even he doesn't like you.
They're talking about you.
Let's call the cops.
You're worthless. You're stupid.
You can't trust him. You don't trust him.
The Diagnostic and Statistical Manual of Mental Disorders, or the DSM, is a reference book used to diagnose mental health and brain-related conditions. The fifth and most current version of the manual was released in May of 2013, and it is this version that is used to guide clinical decisions. In the DSM-5, schizophrenia is classed as schizophrenia and other psychotic disorders. When a clinician is determining diagnosis for schizophrenia, an individual must meet the criteria specified within the manual. To ascertain this, a thorough systems review and a mental state examination must be performed after collecting a complete psychiatric history in order to assess the patient's appearance, behavior, mood, speech, cognition, and insight, as well as to look for signs of perceptual delusions or formal thought disorders. Even though the diagnosis of schizophrenia is clinical, meaning that it cannot be diagnosed via medical testing, there are specific laboratory and radiographic tests that are helpful to rule out medical areas that should be reviewed. Urea and electrolytes. An electrolyte imbalance can cause delirium. Serum calcium, hypothyroidism, or hyperthyroidism can on occasion have psychiatric manifestations. Blood glucose. Hypoglycemia can produce confusion, which can be mistaken for psychosis. And lastly, a drug screening to ensure that symptoms are not influenced by patient drug use. Once these initial determinations are made, the clinician can then determine whether or not an individual meets the criteria for schizophrenia as outlined in the DSM-5. An individual must have at least 2 of the characteristic symptoms in Part A: delusions, hallucinations, disorganized speech, grossly disorganized or catatonic behavior, or negative symptoms such as affective flattening. Moreover, the individual must experience these symptoms for a significant portion of a 1-month period of time. There is a caveat, however. For individuals who experience voices that provide a running commentary on their behavior or thoughts, or who have 2 or more voices conversing with each other, for those individuals, they need not have additional characteristic symptoms. However, an individual's level of functioning must be impaired in 1 or more major areas: work, interpersonal relations, self-care, or failure to achieve expected levels of functioning when the onset is childhood. Duration is another factor in this clinical decision. Continuous signs of disturbance must be present for at least 6 months and must include at least 1 month of symptoms that meet characteristic symptoms. Another criterion that must be met is that schizoaffective disorder and depressive or bipolar disorder with psychotic features must have been ruled out. Additionally, as mentioned, substance abuse must also be ruled out for the cause of the disturbances. And finally, if there is a history of autism spectrum disorder or communication disorder of childhood onset, this diagnosis is only given if prominent delusions or hallucinations, in addition to the other required symptoms of schizophrenia, are present for at least 1 month. Once an individual receives a diagnosis of a schizophrenia spectrum disorder, a specifier may be added to the initial diagnosis following annual consultation. Specifiers may not be added any sooner than 1 year following the active phase of schizophrenia. The attached specifiers indicate several variables. The first indicator is an indication of whether or not the persistence of symptoms in whole or in part and remissions. A second indicator may note catatonia, a condition in which speech and activity may stop. An additional indicator will note the severity or range of schizophrenic symptoms, such as delusions, hallucinations, and disorganized speech. There are no longer types of schizophrenia as was seen in the DSM-4, meaning paranoid type, disorganized type, as the updates to the DSM-5 better reflect schizophrenia as a spectrum of symptoms that vary.
Currently no consistent genetic factors to confirm schizophrenia. If schizophrenia runs in one's family or there is a chemical imbalance in the brain that occurs naturally, one may be more susceptible to developing it. In addition to the genetic factors, environmental risk factors for schizophrenia include stress, exposure to toxins or viruses while the brain is developing, head injury, and the use of mind-altering substances. Despite the fact that the disease prevalence varies around the world, estimates suggest that schizophrenia affects about 1% of adults worldwide, compared to 0.6 to 1.9% in the United States. A claims analysis has estimated that the annual prevalence of diagnosed schizophrenia in the U.S. is 5.1 per 1,000 lives. Liz Heng, 2006. African Caribbean migrants and their descendants have a higher incidence, and men are slightly more likely to be diagnosed and experience an earlier onset than women.
Schizophrenia is typically diagnosed in late teens to early 30s, and with this being the case, many times students go undiagnosed, of course, because they're younger and they're not exhibiting full onset of all symptoms of schizophrenia, but there are signs many times. A child might be experiencing psychosis, hallucinations, paranoia, lack of social skills, lack of personal hygiene, maybe doesn't want to go to school because of these symptoms. And so it's very important for teachers to be aware of the signs and recognize what's going on so that there can be an earlier treatment of symptoms and help prevent, an onset of more symptoms occurring. I included a link for signs that teachers should be looking for. And also, other things that can affect the academic learning of this student include the fact that before the onset of schizophrenia, they can show signs of lack of cognitive ability and a lack of IQ. Now, vocationally, people with schizophrenia, their work prognosis depends on many different factors. Is the person supported by family members, by their job? Does their job understand the mental illness that they're suffering with? Were they recently diagnosed? Are they properly using their medication? Do they have good medication management? Do they have the support of coworkers, family members, as I said, flexible scheduling? Is the work environment, a decreased stress level for the schizophrenic person? All things like that can help the schizophrenic person deal with keeping a job and actually have positive outcomes and teach them about work management, money management, all different, life skills to help them be more independent. Living alone can be a challenge for people with schizophrenia. It could also be risky, depending on many different factors. Is the person using proper medication management? Are they experiencing psychosis? Is psychosis more triggered when they're living independently? Do they have family support? Do they have financial support from being able to maintain a job? Are they able to get SSI, et cetera? All factors to help financially support themselves. Now, also, some people may have coexisting other issues, such as other mental illnesses, other physical disabilities, in combination with the schizophrenia, which would make this even more challenging. And many people with mental health illness struggle also with substance abuse disorders. So all of these are going to go into impacting the independent living of a person with schizophrenia. A study conducted did find that residential care facilities are a great option for people suffering with schizophrenia. They can help assist with independence, job management skills, independent management skills, while also helping them with medication management and just being a support to them and having other people around that are suffering through the same thing while also simultaneously gaining independence. Now, many studies that I found were 10 plus years old and many things have changed since then. So I think it would be good if more updated studies were conducted because technology and other sort of assistive tools have been upgraded since those times.
Similar to the symptoms, the treatment options also vary from person to person. One person with schizophrenia may only use one or two of these treatment options, while another person may use all of them. Treatment options for those with schizophrenia have grown considerably from what was even available 20 years ago. Today, treatment frequently consists of a mix of pharmacological, psychological, and highly coordinated specialized care. Pharmacological options range from antipsychotic medications as a first line of treatment option used in schizophrenia. These are used to decrease hallucinations and suicidal ideations. Drugs like temazepam are used to help with sleep disturbances common in schizophrenia patients. Access to 24-hour crisis support is essential not only for episodes of psychosis, but also for other dimensions, such as significant depressive episodes and suicidal ideations. Additionally, for medical supports, there is electroconvulsive therapy, or ECT, what you may know more historically as shock therapy. In ECT, a short electrical current is used to stimulate the brain. The procedure takes place in a hospital under anesthesia. Salick and Marwah 2022 say that ECT relieves depression and other mental disorder symptoms. There are a range of psychological treatments. I will just name a few. Cognitive behavioral therapy and cognitive behavioral therapy for psychosis, which was developed for more serious disorders such as psychosis and other lingering symptoms that do not improve with medication alone. There is also supportive psychotherapy, which places an emphasis on the present moment rather than the past or present trauma. Psychosocial therapies offer comprehensive care for patients with serious mental illness. Assertive community therapy is one such therapy. Professionals with ACT assist people with proactive problem solving, crisis avoidance, and medication adherence. In addition to traditional treatments and therapies, there are a wide array of alternative treatment options. These options can include acupuncture, meditation, nutrition, and supplements like omega-3. These alternative therapies support treatment but do not replace it. The American Psychiatric Association, 2020. Lastly, there are academic treatments. Stressors are less likely to cause exacerbations or social decompensations of schizophrenia when people are prepared with the coping mechanisms to deal with stressful life events and everyday difficulties, like the social and academic demands a student would experience within their school environment. Interventions such as speech and vocational training support learning to communicate and function in real-life scenarios, and can also help dissipate stress when students experience real-world situations during and after their educational experience.